latest review from 2026, magnetic attachment is considered as a moderately requiring inter-arch space required. And here are, as you can see, other attachment types has been utilized in implant dentistry, such as bar, ball, locator, equator, and so on. Now let's move to the fundamentals of magnetic attachment. Magnetic attachment is mainly consisted by two components. The first one is the magnet assembly, which is usually embedded inside the denture base of the prosthesis. And the second component is called root keeper that are usually being cemented or fixed onto the abutment tooth or implant. There will be a magnetic force between these two components that plays as the retentive force, that plays as the retentive mechanism of this attachment type. As the unique characteristics can be offered by this kind of attachments, some benefits has been reported. In this opportunity, because we don't have so many time, I will highlight the main advantage of the magnetic attachments that usually cannot be found in other mechanical-based attachments, such as stable retentive force, minimizing lateral forces, easy insertion and removal, and also it can be reusable for new denture and also has easier maintenance for cleansing or hygiene procedures. Okay, let's move to the first one. Generally, prosthodontic attachments over the insertion and removal cycles, the retentive force of those mechanical attachments tends to decrease over time. In contrast, as we can see in the graph on the right, magnetic attachments has been proved to be able to provide a stable retentive force over those insertion removal cycles. Moreover, the recent development of magnetic attachments that our research team is currently developing and also performing research at Tokushima University and in Japan, we have been reporting that the retentive force of the new magnetic attachment has been increased significantly compared to previous generations. As we can see from this study, from 9 years evaluation period, the retractive force of magnetic attachments did not decrease significantly. As you may know, during the function of the mastication function, the abutment tooth or the implant may occur some many complicated occlusal stresses, especially lateral forces. If those lateral forces are transferred through the abutment tooth or the implant structure, it can cause a deteriorative effects that will cause some damage surrounding the implants or the abutment tooth. However, magnetic attachments has a unique properties that they can reduce those harmful lateral forces when applied to their surface. The upper part of or the magnet assembly can be displaced horizontally for a moment so that the lateral forces does not distribute fully to the underlying tooth abutment or implant abutment. As we can see here, it can be displaced slightly in a horizontal position and they can return to its original position. And regarding the easy insertion and removal, as the surface of the magnetic attachment is flat and they doesn't require any specific insertion and removal path, as they doesn't require any specific path of insertion, it can be inserted easily by the patients from any directions. For example, like this, it will be seated automatically using their magnetic forces. Regarding the applications of magnetic attachments in dentistry, there have been many applications such as starting from overdenture, either retained by natural tooth or implants, partial dentures retained by tooth or implants, and maxillofacial prosthesis, and also implant supportive prosthesis that we will talk in detail in the next session. This is one of the case example that has been delivered in Tokushima University Hospital, in which the patient came with a failed previous fixed restoration, and then the remaining tooth that can be saved is converted into an overdenture with magnetic attachment. As we can see here, this is the final prosthesis results. Another case using magnetic attachments that has been delivered in Tokushima University also involved in delivering the partial denture. In this case, you can see that the magnetic attachment can be utilized as an extracorneal attachment to retain a removable partial denture. And the image on the right is the intraoral condition or photo of the patient after 14 years follow-up, and there has been no significant complaint or any prosthesis complications were found. This is the example of the implant-supported prosthesis that we will talk about in detail in the next session. And regarding maxillofacial prosthesis, this is one of the example case that was published in Prosthetics and Orthotics International. It can be utilized to connect the intraoral prosthesis with the maxillofacial prosthesis like this. Now let's move to the evidence and clinical applications for implant dentistry. So according to Japan Dental Association and Japan Association for Magnetic Applications in Dentistry, these are the suitable cases for magnet-retained implant prosthesis. It can be applied especially in patients for special needs and manual dexterity, in which these patients usually cannot move their hands freely, and they really had difficulty to control their strength and directions to insert and remove their own denture. And in the case of where the peri-implant tissue health or the hygiene maintenance is prioritized, magnetic attachments are also recommended. It is also can be applied to the prosthesis in which the palatal plate should be free or should be released. And also if the implants can be inserted into the patients in a symmetrical layouts. And it can also be utilized in a bilateral free end. For example, in this implant-assisted removable partial denture, or we can say it later as IARPD. In 2021, we performed a systematic review evaluating the outcomes of implant-assisted removable partial denture applied in distal extension-based dentures based on the Kennedy classification. From those gathered studies, most of this IARPD was applied to Kennedy Class 1 and Kennedy Class 2, representing a distal free end cases. And from those included studies, the survival rate of the IARPD with various attachments were reported from 91.6% to 100%, and the marginal bone loss starts from 0.3 until 2.3 millimeters. And based on our analysis in this systematic review, we concluded that IARPD can provide us a viable prosthodontic treatment option for distal extension edentulous areas, which can yield favorable clinical outcomes. Here, I would like to introduce some of the randomized controlled trials of IARPD using specifically magnetic attachments. These are also RCT studies from Japan, and these two studies perform analysis comparing the removable partial denture, IARPD with healing cap, and IARPD with magnetic attachments on Kennedy class 1 or 2. And the study results reported that the IARPD with short implants and magnetic attachments improved the comminuting ability and occlusal contact area. It also improved the maximum bite force compared to the healing cap and improved the oral health-related quality of life of the patients. And regarding the patient-reported outcomes, it also significantly improved patient general satisfaction and also patient danger assessment. Another application of magnetic attachments in implant prosthesis has been also reported to support maxillofacial prosthesis. In this review in 2005, it was reported that many advantages were gained by fixation of the prosthesis using magnetic abutments with implant as support for the maxillofacial prosthesis. These are the examples of the orbital prosthesis and auricular prosthesis that is supported with implants with magnetic attachments as a connector or as an attachment to retain the maxillofacial prosthesis. The other applications of magnetic attachments in implant dentistry are also commonly utilized for implant overdentures, or hereby we can abbreviate it as IOD. This is a case by Dr. Yuichi Ishida in Tokushima University. And this is the condition of the initial visit of the patient. So the patient came with the chief complaint of uncomfortable and non-retentive lower denture. So we can see here, there is only slight remaining alveolar bone. And then based on the preliminary CT images and treatment planning, there was insufficient bone thickness for the placement of the regular implant size. So it was decided to place a mini implant for the restoration of the mandible. This is the surgical procedures. It was started by an opening of the flap. Actually, when applying mini implants, it can be applied as a minimally invasive without opening flap. But in this case, because of the alveolar ridge condition is not so good, so an open flap was performed to make sure the position of the implant. And then a drilling and surgical procedure was performed by initial drill and the sequence that I will explain in the next slide. Then the implant placement was performed using hand and torque wrench. Then in this step, the keeper or the lower part of the magnetic attachment was installed. Then it was sutured. These are the drilling steps that has been, we were using the guide drill. We were using the MagFit magnetic attachment and Platon mini implant system from Japan. It can be started by applying the guide drill and then confirmation with the guide pin, and then starting drill, continued by implant drill, and finally implant placement. And then after using the temporary denture for 3 months, a magnet assembly and the definitive denture can be placed. So this upper part is called the magnet assembly. And after that, a silicone holding to prevent the attachment of the self-curing resin to the lower part that can be flown into the undercut parts is placed in this position. And then on the denture intaglio surfaces, an spillway or the fan hole was prepared using burr. And into this space, a self-cure acrylic resin was applied. And then after positioning the denture onto these implants, the pickup procedure was performed. And after the complete polymerization of the self-curing resin, these magnet assembly components will be picked up into the denture part. And afterwards, the excess resin on the polishing surface is trimmed, finished, and polished using the finishing and polishing burr, as we can usually use for acrylic-based denture resins or PMMAs. And this is the final prosthesis results. If you would like to know the more detailed treatment process of this case, it is also published with Professor Kiran Kumar from India. At that time, he was visiting our laboratory in Tokushima University as a visiting researcher from Indian Prosthodontics Society. You can access the case report article from this QR code. Next, the other evidence. I would like to introduce the randomized control trial comparing whether the immediate loading or delayed loading or conventional loading has any effect on the magnetic overdentures. And from this study, it was reported that there was no significant differences in masticatory performance and maximum occlusal force between immediate and conventional loading of two implant-supported overdentures retained with magnetic attachments. And this is a recently published systematic review and meta-analysis published in 2024 regarding the attachment systems for mandibular implant-supported overdentures. This systematic review evaluated these 5 types of attachment systems consisting bar, ball, locator, telescopic and conus, and magnetic attachments. So regarding the implant and prosthesis survival rate, this meta-analysis reported that all attachment system provided high survival rate and doesn't present with any significant difference between those attachment systems. Regarding biological complications, they also reported there was no significant difference among the attachment systems. However, regarding the prosthetic complications, there were significant difference found between the attachment systems analyzed. Here are the further detailed prosthetic complications that they reported from this meta-analysis, such as bar clip activation, magnet corrosion, wear, screw loosening, housing fractures, occlusion modification, denture adjustment, repair, reline rebasing, remake, and opposing denture tooth fracture and speech problems. When it was ranked by the frequency, unfortunately, the most prosthetic complications were reported by magnetic attachments, followed by ball attachments, bar, telescope and conus, and locator. The reason behind this outcome was because of many of the past magnetic attachments that were utilized and included in these studies occurred from the early generation of the magnetic attachments. And those early magnetic attachment generation has been reported to occur some corrosion problems. Therefore, some of the magnetic attachments has to be replaced with a new magnet. Then there's also a review regarding magnetic attachments and why it is being popular in Japan and other Asian countries. So, as mentioned in here, during its initial introduction from 1980s, usually the magnet is placed directly inside the oral cavity without any casing or without any housing or protective components. Therefore, in the past, magnetic attachments were reported to be corrosive, and therefore, if they are being corroded, the retentive force of the magnet was gone. Therefore, the prosthodontist should replace the magnetic attachment with the new attachment or new magnetic attachment. However, as mentioned in this review, the problem of corrosion in magnetic attachment has been resolved, and now the magnetic attachment has been corrosion resistant. Next, I would like to explain the current applications and regulations in Japan regarding magnetic attachments. Have you ever heard about 80-20 program in Japan? It has been initiated from 1918, which the Dental Association and Ministry of Health is promoting that when you are over 80 years old, you need to retain at least 20 remaining teeth inside your mouth. And this program has been success in recent years, and more than half of the populations above 80 years old has been achieved these results. Therefore, it also provides some challenges for oral health care professionals in Japan, such as many patients will come with limited mobility, cost constraint, and they demand, of course, short care time. And there's also many other problems outside their oral cavity, such as multimorbidity, polypharmacy, cognitive decline, home visit, and during the delivery of prosthodontic treatments, a longevity and repairability of the prosthesis or the dental prosthesis should be considered in advance. And more importantly, easy maintenance procedures is required. Why? This is one of the article from the ITI. In Japan, many older adults or super aging, or it is usually called, Japan is dealing with super aging society. Therefore, many of the patients here are being their unhealthy period, which is prone to disease or disability. Many of them has occurred frailty, and if this continues, the physical ability and mental ability of these patients decrease significantly over time. Therefore, in these patients, fixed prosthesis not always become the best treatment, although their excellent aesthetics and excellent mechanical strength, because not all patients can even take care of their mouth, their hygiene properly. Some of them even need the caregiver to assist in cleaning their tooth and their denture in the elderly or elderly care facilities in Japan. And facing these problems, recently, these are the prosthodontic treatments that are being covered inside the national health insurance system in Japan. And uniquely, magnetic attachment is one of the available treatment options there. From 2021, it means that a treatment modality or treatment method that is able to be provided with national health insurance coverage in Japan means that this kind of treatment needs to ensure all residents can access essential medical and dental treatments. And in Japan, magnetic attachment is considered as cost-effective, evidence-based solution for the local problems here, and the benefits over meets treatment needs in Japan. This is the last part of my presentation. I would like to introduce about the recent innovations on magnetic attachments that our laboratory has been researching for in these past 3 or 4 years. So from my previous slides, we can see that in the past, magnetic attachments has some limitations or problems, such as the first one, corrosion, that was reported before 2000s. It was mainly because of the insufficient sealing technique from early generations of magnetic attachments. The other problems or limitations comprises it requires adequate or thick or big prosthetic space clearance. And also it often reported that the presence of the keeper that is being cemented or fixed onto the abutment tooth or the implant inside the oral cavity can cause magnetic resonance imaging artifact. Regarding first problem, I would like to introduce the development of the magnetic attachment. Still remember the magnet assembly, the upper component that contains the permanent magnet that provides magnetic force that is being cemented inside the prosthesis structure. So it consists of the main or core component called permanent magnet that is mainly composed by rare earth magnets. In the initial periods, rare earth magnets such as aluminum, nickel, cobalt, ferrite, platinum cobalt, or samarium cobalt has been utilized. However, they have really bulky structures and weak force. With the innovation of the neodymium ferrite boron, a strong magnet and thin magnet can be achieved. This is the example of how if these rare earth magnets contacts to body liquids such as saliva. If these rare earth magnets are being contact with body electrolytes or body fluids such as saliva, the corrosion can occur on its surface and resulted in the loss of retention. Therefore, as mentioned in the review article that I presented earlier, the early applications of the magnetic attachments are using this open field magnetic circuit, where the magnet or the rare earth magnet is placed inside the prosthesis as it is without any casing or sealing structure. And it contacts with the keeper on the abutment surface, resulting in an open magnetic circuit. That's why many magnetic fields are also being leaked or being circulated outside the magnet and keeper structures. With the development of the structure further, a closed field magnetic circuit was developed. From this era, the rare earth magnet is being cased. For example, in this closed magnetic circuit variations. So with the encasement of the rare earth magnet inside a yoke or a magnet assembly, modification of the magnetic circuits and optimization of the retentive force of the magnet attachments have been made. So after the after the innovation of magnet assembly, the second component that provides as a case for the permanent magnet is called yoke. It is usually made from the hard or from the soft magnetic material made from stainless steel. And on the lower part, the permanent magnets are usually covered by two components called bottom plate and non-magnetic disc or ring. And as mentioned in the previous literature review, the sealing technology of the permanent magnet has been underwent some developments. In the early periods, it was only covered by a thin resin or Teflon coating, which is prone to wear and loss over time. Further development introduced soldering of the components, and the latest development was made by laser welding technique. And from the past literature, this laser welding technique has been reported to be effectively prevent the corrosion occurrence of the rare earth magnet encased inside the magnet assembly. The further development is by modification of the non-magnetic ring, which also influence the distribution of magnetic field, such as in these diagrams, and influencing the efficacy of the retentive force. However, the laser welding spots are also reported as the most prone structure or part of the magnet assembly, as through cycles, it can, because it provides as a connection structure, and throughout cycles, this connection or the laser welding areas can deform if any excess wear or force is applied, or for example, the fixing surrounding resin or surrounding cement is accidentally went into this surface, and it can also deteriorate these welding surfaces. Therefore, in 2022, we have been researching about the new magnetic attachment system with new structure, resulting in an improved strength and solid structure with lower cost. As you can see in here, the laser welded structure has been minimized by half or only 50%, which minimized the risk of the deformation on the joint structures in the past. These are the structural comparison between the previous magnet assembly structures that are being composed with 4 components. Therefore, to connect these 4 components, 2 laser welding lines is required. And with the technology of high frequency heat treatment, we can merge these 2 components into 1 component. This technology resulted in a less welding spot into only 1 line welding spot. We perform the basic experiments and basic evaluations of this new magnet assembly structure and perform a durability test for 10,000 times insertion and removal cycles with 100 Newton load. And we figured out that there was no significant or no notable deformation on the surface, and the retentive force doesn't change after those cycles. Regarding the horizontally displaced position that relates with the automatic reseating feature, special feature of the magnetic attachment, we also perform evaluation using this new magnetic attachment, and it performs similar or better than the previous magnets, as reported in Tanaka et al. From 2016. So this new magnetic attachment has improved structure and also has stronger retentive force even in horizontally displaced positions. So we concluded that this new magnetic attachment with new manufacturing technology provided a favorable retention strength and durability for clinical use. It can be provided as a root keeper type that can be cemented directly to the abutment tooth, or as a cast keeper that should be processed laboratory first as a metal coping on the abutment tooth. Here is the simple video that you can see here of the application of the new magnetic attachments that has been developed from Japan in collaboration with a company in Indonesia, and it has been started to produce and being sold and being utilized in Indonesia and Japan and other countries such as Malaysia and Thailand. This is the example for magnet retained partial denture. And this is the production process. So the end result of this research on new magnetic attachments can be accessed and can be utilized clinically in Indonesia, and currently are undergoing the clinical research in Japan. So regarding the first problem on the corrosion can be solved by the new magnet sealing innovation. Now let's talk about how about the other two problems regarding the prosthetic clearance problems and MRI artifact. So in Japan, we have a specialized academic society on magnetic applications in dentistry. And from last year's message from the chairman, as you can read in here, while magnetic attachments were covered by health insurance system from September 2021, many clinicians still have concerns about denture fractures and whether they still interfere with MRI scans. So as mentioned, these two problems are still being concerned by the clinicians in Japan in applying magnetic attachments. You can see here, as mentioned in the clinical report by Yamamoto and Hideshima, the upper structure of the prosthesis are prone to denture fractures because of the lack of prosthesis thickness. And on the tooth side, the aggressive tooth reduction can also increase the risk of the fracture. When placing the magnet assembly or keeper to the denture or to the abutment teeth, sometimes these things can happen. This is when I fabricate the denture during the investment process. So because of the magnetic attachment in conventional size takes so many space, sometimes we need to reduce the artificial teeth until this thin. And of course, the risk of fracture in these surfaces are increased. According to the report by Hisako et al., denture fracture also one of the most concern in the dentures delivered. This is where our research comes in. You can see the picture on the right is ATM card, or just for the thickness comparison. And these two pictures are the magnet assembly and the keeper. So by utilizing the same technology, an ultra-thin magnetic attachment with ultra-thin thickness with only 600 micrometer of the magnet assembly and 400 micrometer of the keeper has been innovated. Regarding the structure, as I mentioned in the previous illustration, a further innovation was conducted on the magnetic side. So with the utilization of the thin ring type neodymium feathered boron magnet and the magnetic stainless steel, an ultra-thin structure can be achieved. These are the dimensional comparison between the ultra-thin type and the conventional type of magnetic attachment using the same brands. And the other brands usually also starts from this dimension, which in total they require around 2 millimeters or above with similar diameter. The presence of UTMA improves the 50% thinner and requires less clearance space and minimizing the abutment tooth reductions and also prosthesis space. And this currently present as the world's thinnest prosthodontic attachment available. Using this new UTMA, we attempted to evaluate its clinical applications and durability in the form of magnetic removable bridge. So we also evaluated its durability, similar with the previous study. We evaluated the retentive force, performed 10,000 times insertion and removal cycles with 100 Newton load, and we did not found any significant retentive force reduction. Regarding surface, despite of the ultra-thin structure, we did not find any surface deformation compared to before the durability test. And this is the magnet assembly part on the prosthesis side. And if you would like to know more about this ultra-thin magnetic attachment, our research has been published in Dentistry Journal in 2025 and has been featured as the cover issue in that time. You can access by this QR code. So how about applications in implant? Unfortunately, these new magnetic attachment systems are not available yet with implant systems. However, with the advance of digital dentistry, if you are already familiar with the fabrication of custom abutments, and if there is any dental laboratories that can provide those custom abutments, you can also apply it using the casting type or apply the keeper directly on the custom abutment, such as in this side, where you can prepare the space or housing space on the custom abutment sites using this computer-aided design softwares, and then mill or 3D print the and then continued with CAM process, manufacturing process, and then you can place it. So regarding the clearance space, the UTMA has been present to tackle this limitation. How about the MRI artifact? So using this UTMA, a study by Tanaka et al. Was published in 2025 and reported that the UTMA thin keepers has been significantly reducing the size of the MRI image artifact compared to the conventional size of the magnetic attachment from the other brand, as you can see in these diagrams and these pictures. So from those study by Tanaka et al., we wonder how if the thickness of the ultra-thin keeper is reduced, how about the retentive force? Could it still provide an adequate retentive force or not? So we performed this experiment further, and we figured out with the ultra-thin magnetic attachment system, even until reducing the keeper thickness until 0.2 millimeters, the retentive force did not reduce significantly when using 0.2 millimeter until 0.8 millimeter keeper thickness. So we concluded that even reducing to 0.2 millimeter keeper, it can still provide clinically acceptable retentive force. And if compared with the previous conventional magnetic attachment systems, the retentive force unit per volume is approximately 2 or 3 times higher. So we concluded from these studies that MRI artifact area can be significantly minimized using UTMA. Even using the minimized keeper that is available from 0.4 until 0.2, the retentive force did not reduce significantly and demonstrated superior retentive force per volume. So these 3 problems or limitation of magnetic attachments are expected to be solved with these new innovations in magnetic attachments. Now, how about the biological effects, safety precaution of the magnetic attachment to the patient's body or surrounding tissues? Regarding the magnetic field leakage, it is far below the WHO standard, which was declared around 40 millitesla, and usually the magnetic field around the magnetic attachment is just around 5 millitesla. And regarding the metal detectors at airport security checkpoints, usually it will not has any problems. And the impact on the MRI, as I has mentioned in the previous slides, the presence of the ultra-thin structure can solve this problem in the future. How about the patients wearing the cardiac pacemakers? It was considered safe because the distance between the magnetic attachment is quite far from the sternum area. So further regarding the bioeffects, there has been some studies in the past evaluating the static magnetic field from implant structures and the effect on the surrounding tissues. In this review, it was reported some tissues level change, that is increased blood circulation, calcium deposition, and some parameters related to osseointegration were increased in response to static magnetic field effect surrounding the implants. These are some two studies from my colleagues, one from Indonesian Prosthodontics, from the past Indonesian Prosthodontics Society director, and also from one of our lab member in the past, Dr. Naito and Professor Ichikawa, regarding the static magnetic field in rabbit femurs study. From these two studies, they figured out that the presence of the static magnetic field surrounding the implant that is coming from the magnetic healing abutment can significantly increase the fibroblast growth factor and bone morphogenetic protein, suggesting faster osseointegration. And from the other study, it was suggested that there was a higher bone to implant contact ratio was observed compared to this control group. Before I close my presentation today, I would like to introduce about the dental magnetic research project that has been established since July 2023. And from this research project, we have been issuing a dental magnetics newsletter that will be released in every 4 months. This is the picture of the International Magnetic Symposium that was held in Aichi Prefecture, Japan in 2023, along with the establishment of the dental magnetic research projects. Some dentists and researchers from Indonesia, Japan, Thailand, and some other countries remotely from Taiwan and China and Korea has been attending this research project meeting. Currently in Japan, we have been performing studies in 3 universities collaborating with this research project, that is Tokushima University, Institute of Science Tokyo, and Tokyo Dental College. And here are some take-home notes that I would like to deliver before ending this presentation. So magnetic attachments has been utilized long historically in prosthodontics and implant dentistry for decades and providing unique retentive mechanism that cannot be found in other attachment systems. Their applications in implant-assisted removable partial denture has demonstrated a high survival rate and favorable clinical outcomes. And recently, it is being highly utilized in Japan in their national health insurance system, and recent innovations on magnet assembly structure from recent research has been established ultra-thin structure on magnetic attachment that are being expected to solve the past problems of magnetic attachments. And the presence of these innovations are expected to solve the limited prosthetic clearance, corrosion problems, and also the MRI artifact. This is the end of my presentation. Thank you very much for your attention.
Thank you very much, Dr. Adityakrisna Yoshi Putra. Very widely you spoken about the magnetic attachment systems in relation to the overdenture, especially the root-supported overdenture. And you also explained that there are very little amount of advancements has happened in relation to the implant-supported overdentures. And you explained it properly, like you can use the castable abutments in relation to the magnets and direct cementing types, how we can make use of it. No, may I know why this kind of limitations is happening yet in case of implant supported over dentures? Why can't we furtherly move towards it?
Okay, thank you very much for your question, Dr. Senivas. So actually, as you may know, from the previous generation of magnetic attachments, why we still cannot provide and cannot perform the recent studies using these new structures in implant structures as you addressed. Because in Japan, to be able to reach the clinical or research approval on clinical studies using the implant structures, it requires long procedures and long evaluations of the biocompatibility examinations. And current research and current clinical research being conducted in 3 universities in Japan are being performed in the last 2 years in order to so we can advance so we can proceed further to the implant applications because as you may know in Japan and maybe in India also the regulations regarding the applications of dental materials in implant is in a higher grade because they will contact directly with the surgical procedures that will contact directly with the biological tissues in comparison to the tooth in comparison to the tooth retained ones because it is being contacted directly with the hard tissues instead of the uh, regeneration that involves the bloods and the other systemic effects, possible systemic effects. So for the time being, if you would like to collaborate and interest in performing the new magnetic attachment for your applications, for your implant applications, we can provide from Japan by sending the magnetic attachment and the keeper to your place. And we can collaborate with the support of the digital dental technicians to create the custom abutment together. As you may know, the several implant systems such as Dentium, Nobel, Stroman, and the most of the implant systems are suitable with the MagFit, one of the leading magnetic attachment system in Japan that has been utilized by a lot of implant systems in the past. So before we can proceed to that stage to be able to collaborate with the implant makers, we need to establish by the performing this basic research at first, and starting from the tooth retain and application on the non-surgical procedures is considered as the initial stage. So we hopefully to apply it in the implant research soon in the future.
That's great. So Satyabos sir?
Yeah. Hello, hi, Srinivas. Uh, Aditya, I just wanted to know this new system. You said about the sealing of the yolk, the laser welding that has been used. Is the same
Yes.
technology you are using it?
Yes. So thank you for your question, Professor Satyabos. So actually the laser welding is same, but the new technology that has been differ it from the previous one is the fusion of the two components. As you may know, in order to optimize the magnetic circuit of the magnetic attachment, a small piece of non-magnetic ring is required. So from the presence of those small non-magnetic ring, so maybe it is easier if I share the structure once again. Sorry. So for you to
So for that you have used a stainless steel?
Yes, stainless steel.
What series of SS?
So HUS 316L, same grade with the implant ones.
Okay. But I think Marine series is the one which is to be used.
Which series, Doctor?
Marine series, SS416 marine stainless steel, which is used underwater.
Marine, yeah. So,
So that will prevent the corrosion further.
yes. So
is that the one which is being used here? Is that the one which is being used?
yes, so the one that is being used in here is the SUS. For this part of the cap one is the SUS 436. So in this bottom, in the oral cavity, in the keeper part, SUS 316L is being used. So in the magnet part, that is, this part will be mainly embedded inside the resin or inside a resin cement, right? So in this part, SUS 416 is being used. Highly corrosive resistance, but less corrosive resistance than SUS 316L. Because in 316L will directly contact with saliva in the oral cavity because they are cemented inside the oral cavity. I hope this illustration can answer your question, Professor Satya Bose. So laser welding.
The numbers you are given there, MT 500, 700, and 900. Is it related to the gram force that is being generated by the magnet?
Yes, these are related to the gram force strength. So the 900 represents the 900 gram force of magnetic force, and the diameter is 4 millimeter, and there is a 3.6 diameter that can produce 700 gram force strength, and the 3 millimeter diameter that can provide 500 gram force strength. So in here, basically, the precise laser welding technique is similar with the previous generation, but the one that differs is, please take a note. Please take a look at this part. So in this high frequency heat treatment, so if we can make it simple, previously it requires a different component called this non-magnetic ring, right? So in the new structure, this is not necessary anymore because instead of using ordinary stainless steel, we are using the magnetized stainless steel. So this bottom plate are being magnetized first, and then after being magnetized, it underwent the high frequency heat treatment. As you can see in this illustration, it is being passed through a heat. So the outer structure, demonstrated by this light blue structure, are being demagnetized. So in one structure, it can provide as a magnetic structure in the middle, and in the outer surface, it is being non-magnetized. So it can provide the magnetic circuit concentration efficacy similarly with this.
When you use this high frequency heat, don't you think, how do you control this magnetic power of the magnets? Because it will lose when heat is applied, I mean, we lose the power, energy.
I see. Okay, so the process of this high frequency heat technique is performed separately, doctor. So before these three components are being assembled and laser welded, these three components are being manufactured separately. So this cap or this yoke part is being separated, is being produced or manufactured separately. And then the neodymium magnet is also being still in the separate component. And during the fabrication of the stainless steel, this bottom plate, during the cutting process until this small disc bottom plate part, it underwent this process. So the heat treatment technique is not applied to the magnetized structure yet. So after performing those laser welding, it will underwent the overall magnetization process again in the last part. So it will not bother the performance of the permanent magnet in here. As you mentioned, a high heat can remove completely the magnetism of the permanent magnets. But this process was performed separately.
After laser welding, you increase
Yes.
the Bmax.
Yes. Yes.
Okay. So generally, after how many years have you noticed the loss of Bmax, the maximum energy of the product?
So
how many usage?
So in Indonesia, the clinical applications has been underwent until from 2022. So now it's ongoing 4 years, and there was no report of the loss of magnet retention. The problem is mostly because of the detachment, because of the dentist doesn't apply any appropriate sandblasting and metal priming adhesion procedures. But regarding the magnet body itself, for the longest clinical application in Indonesia, 4 years behind, there was no particular problem regarding the loss of magnetic force. And in Japan, in Institute of Science Tokyo, they are also in Tokushima University, we perform it using insertion and removal cycles for 10,000 cycles, right? It can be representing around 9 to 10 years equal to clinical use of insertion and removal. And in Science Tokyo, they are also performing the grinding test. So they are also performing grinding tests and did not find any significant reduction of the magnetic retention force. And from the other university in Tokyo Dental College, they are performing the durability of this new magnetic system against the corrosion using many acidic liquids such as denture cleansers and also such as acidic liquids from drinks or foods. And they have performed according to the some of the standards and did not find any significant deterioration on the surface of these new magnetic structures. However, the data has been published in local academic conferences in Japan, and I cannot share the data yet because it is still confidential. They are still preparing the publication manuscript.
But that's very interesting, Aditya, that it can give a good solution for, especially I have been using these magnets for maxillofacial prosthetics and also for tooth retained dentures and all. But if this is giving a good solution, definitely it is, I think, something way out for the patient's care.
Yes, we hope so. We hope that this innovation can be useful for the future and also can, I think in the past, maybe if you talk with the dentists from Europe or America, they still has the impression of, oh, why you use magnet? Isn't it corrosive or not? Because, well,
Yes.
as mentioned in the review, it is still mainly used in Asian countries. Yeah.
Yeah. I have faced a lot of criticism
Yeah.
while using these. That's okay, but I know what are the benefits of magnets.
Yeah.
And
Especially,
maybe that's why Ramesh has chosen me to be here.
thank you so much, Professor Satyavati. If we can do any collaboration
Sure.
in the
I would
future,
be very much
please,
interested. I'll take contact of yours
yeah,
from Ramya.
please let me know. Let's collaborate in
Sure.
the future. Thank you
Sure.
very much.
Thank you.
Hi Aditya, in continuation with the previous question which I asked, like for the laboratory part, like in the library, like we use exocats and all. Do you provide any kind of library where we can try to attach this magnetic system? If in case if you're going with the milling part, do you have any library for that?
Okay, thank you very much, Dr. Srinivas, for the question. So for my research currently, I am using exocat and also 3Shape dental systems. However, Regarding the easier workflow, we prefer to use the three-shape dental systems better because why? Because they in exocad it is a little bit more difficult to adjust the parallelism between those. If we are going to design the custom coping on two abutments, so if we are, you can utilize the feature of attachment, right? Attachment to add structure or to subtract structure. When we try to prepare the housing for the cementation of magnet to the custom abutment or coping in exocad, we figure out some problems to in the pixelation. So after the round, we really want to the surface of the abutment. The surface of the custom abutment or the coping is flat, right? So if there are some irregularities, those irregular structure will get in contact with the magnet first. Therefore, the force of the magnet cannot be transferred or cannot be working successfully or optimized. So for our research, we are more often using the three-shape dental systems, and in combination with, have you heard about 3D systems?
Yeah.
3D system. We are using 3D system with the haptic touch. So even though it is digital, we can still try to touch and polish it and make sure it is flat and all of the finishing surfaces. So, but after all, any digital, any CAD softwares can be utilized. At the end, you will need to modify it further using the third-party or non-dental applications. For example, if you use the free mesh mixer, you can also do it, but in a more difficult way than 3D systems. But anything you can use. You can use exocad or Medit system or also Dentsply system and 3D 3D system. But in our experience, comparing the exocad and 3D system, the workflow is easier with the 3-shape.
Okay.
Srinivas, if I can add to this,
Sure, sir.
Since there is a root keeper and all diameters are available, and we can easily create them on mesh mixer and do the Boolean difference subtract in the meshes, and we can create a space basically, and that can be cemented onto this thing. Am I right, Aditya?
Yes.
Yes.
If you're already familiar with mesh mixer and also those non-dental general use CAD software, you can basically generate the custom abutment or the custom coping first on these dental softwares, and then you can just prepare the holes or the housing space in those general CAD softwares at the end. But the thing that you need to calibrate at the last is you need to bring it and make sure the milling path. If you're going to fabricate with the milling path, please make sure the milling bar milling path when you are going to just right before you start milling the prosthesis, because sometimes if we use the non-dental softwares, they cannot recognize if you make this 0.3 space or this kind of angle, they cannot warn you that, this kind of design cannot be reduced or subtracted by the milling burr efficiently. And we have been encountering such kind of problems previously because we are using general purpose software, and if we don't calibrate or if we don't simulate it in advance, the post milling adjustment will be required. Usually the space on the corners, usually the milling burr, it depends on your milling burr diameter and path of milling. They couldn't provide space. So when we try in the keeper onto the custom coping or custom abutment, what happens is it will be like this, like the keeper or the magnet is slightly above the coping. So we don't want this kind of structure, because the keeper or this structure will receive most of the occlusal load. So we're afraid of the deformation because of the load is only transferred to the magnetic attachment structure and not distributed evenly with the surrounding prosthetic structures.
Yes, yes. Ramya, can we have questions from the viewers?
Yes, sir, definitely.
Yeah. Dr. Aditya, can you take few questions from our viewers?
Yes, of course.
Ramya, can you ask questions if they are?
We are inviting the questions from the participants.
Yeah. If any questions are there in the chat box, please can you put it forward for the Dr. Aditya?
Yes, sir.
Yeah.
Participants, kindly unmute yourself and proceed with the questions, please.
I think everyone has understood well. It would be great, Dr. Aditya, like if you could share your workflow in relation, especially in relation to the maxillofacial implants and the implants, because the usage of magnets is very much important, but at the same point of time, there is not sufficient amount of workflow, like even from the technician's point of view also, because they don't know how to go about it. So if you could share, and as Sadi is also, Satyabha sir being my teacher over here, so if we could share the workflow, and definitely we'll be in a position to use these products in a much more precise way. So problem lies with it that we don't know really how precisely these magnets has to be used. And as the servers also asking questions, like there are certain inculcative problems. What we were using before was the Sumerian magnets, and those are all not so good to use actually, to be very honest. So since you're new, when I mean your collaboration with your magnet, probably in future, probably our Indian patients will also be benefited out of it. So I would say it's definitely a wonderful presentation, Dr. Aditya, and hope, sir, please, closing
Yes,
word.
definitely. It was a nice presentation, Aditya. I would love to see these magnets and also use them. If you can part of any clinical trial protocols, I'd be very happy to take forward. And as I mean, Srinivas is also into maxillofacial, and he has been also using. So we love to see these magnets being used in maxillofacial prosthetics more, which is more meaningful, basically where retention is quite affected for the prosthesis. So I think this would be a great this thing. Looking forward. Thank you, Aditya.
Thank you,
Thank you
sir.
very much. Thank you very much, Dr. Srinivas and Professor Satya both, and for your suggestion as well. So please reach us anytime, and we can also discuss and provide the supporting data and workflow from here, and collaborate with the maxillofacial prosthesis. And previously, we have been dealing with maxillofacial prosthesis from Thailand, from Mahidol University, and we have provided collaboration in such designing and the workflow to fix the magnet components to the prosthesis, and also consult together and discuss together regarding the prosthesis material, so that the attachments can work successfully. I really would like to looking
Thank
forward
you.
to our collaboration in the future. Thank you very much for the opportunity.
Thank you.
Thank
you so much.
Thank you, Dr. Aditya. Dr. Aditya, there is a question from one of the participants that are these magnets available in India? The participant name is Gauri.
Okay, thank you very much for the question, Dr. Gauri. So unfortunately, there is currently no official seller in India yet. So if you would like to try for the your clinical purpose and or for research purpose, you can I can give you the company information, contact person, so they can send you the samples for your clinical use and for research use. Everything is welcome, so we can ship it. I can ask the company to ship it internationally, or maybe if I have an opportunity in this upcoming year, it is still uncertain that in the next upcoming OSI event, if I come there, I can also bring the magnetic attachment samples or the products to there, so the Indian dentist can start using it there. Unfortunately, the reseller or distributor, there is no distributor yet in India.
So she replied saying that that would be great. Can you please share the details? We'll be happy to do some research on that.
Yes, I'm gonna share my email address in the chat box. So afterwards, please reach me through this email, and I will follow up your inquiry with the company, so they can follow up for the either for the clinical use or for the research use.
Thank you, Dr. Aditya.
You're welcome.
So, any more questions? So, as we come to the end of this insightful session, I would like to express my sincere gratitude to Dr. Aditya for his enlightening lecture and the valuable insights. Also, I convey my heartfelt thanks to Dr. Srinivas sir and Dr. Satyabodh sir for their expert observations and enriching contribution as panelists. Thank you, sir. Finally, thank you to all of our delegates and participants for your active presence and engagement. On behalf of OSI, thank you all for making this webinar a grand success. Have a wonderful evening, everyone.